Leukemia refers to a malignancy of hematopoietic cells in the bone marrow, and this can be either acute or chronic depending on the course of the illness. Acute leukemia is characterized by a rapid onset and progression, and if left untreated, most patients die within several weeks to months. In acute leukemia, the malignancy involves early hematopoietic precursor cells, also called blast cells. And these blasts have the ability to multiply rapidly, and that explains the rapid onset and progression of the illness. Contrast this with chronic leukemia, in which there is a malignancy of relatively mature cells in the bone marrow, which multiply more slowly and therefore have a longer course of illness. And if left untreated, most patients with chronic leukemia would die within months to years. The defining feature of acute leukemia is the presence of more than 20% blast cells in the bone marrow on bone marrow biopsies. The normal blast count in a person without leukemia would be between 1 to 2%. So this is a hematopoietic stem cell within the bone marrow, and this cell can divide into a myeloid precursor cell called a myeloid blast, or into a lymphoid precursor cell, also known as a lymphoid blast cell. The lymphoid blast undergoes multiple steps of differentiation to end up with a mature lymphocyte, which is either a B lymphocyte or a T lymphocyte. The myeloid blasts, on the other hand, um, also undergo multiple steps of differentiation and end up either with a megakaryocyte, which give us platelets, or into red blood cells, granulocytes, which are your neutrophils, eosinophils, or basophils, and finally into monocytes, which give us macrophages. And these three cell lines, the lymphocytes, monocytes, and granulocytes, are collectively known as the white blood cells. Now, acute leukemia is a malignancy in the early precursor cells, the early hematopoietic precursor cells, and the blast cells. And these can be either a malignancy of the myeloid blast cells, the myeloid lineage, in which case it is known as AML, or a malignancy in the lymphoid lineage, the lymphoid blasts, and this is known as ALL, acute lymphoblastic leukemia, or an acute myeloid leukemia. And these leukemias occur when there is a mutation or mutations that lead to loss of the ability of these myeloid and lymphoid blasts to differentiate. So these cells cannot differentiate, but they can proliferate. So when these cells cannot differentiate into more mature cells, they will accumulate within the bone marrow. And they will keep dividing and accumulating inside the bone marrow. So this is your bone marrow, and these cells will keep accumulating inside the bone marrow and crowd out the other cell lines of the bone marrow and replace the bone marrow eventually. So these will crowd out your red blood cells, leading to decreased red blood cells in the bone marrow, and this will lead to anemia. They will also crowd out the platelets, so reduced platelet counts or thrombocytopenia, and this results in bleeding tendency. And they will crowd out other white blood cells such as neutrophils, so reduced neutrophil counts, and this will lead to repeated infections. And eventually these blast cells will spill into the blood, into the peripheral circulation. And from the blood, these cells can infiltrate other tissues in the body. So in summary, acute leukemia is caused by acquired mutations that result in failure to differentiate but preserved ability to proliferate. And this leads to accumulation of blast cells in the bone marrow, which crowd out the other cell lines, resulting in anemia, bleeding tendency, and infections. And these are the usual presenting features of acute leukemias.